Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about levels of care. We spoke first with Dr. Catherine Pichon from St. Tammany Physicians Network's Madisonville office about primary care and the family practice. We'll talk next with Kira Smith, who's a nurse practitioner with St. Tammany Health System's Express Care Clinic. Kira will talk with us about express care and about urgent care. So Kira, thank you so much for coming in today.
Thank you, Melissa. Thanks for having me.
Really excited to have you here because you're talking about something that I find fascinating, and that is the idea of having primary care at more convenient hours. And at St. Tammany Health System, we're calling that express care. So talk a little bit about your clinic.
Sure. We're committed to providing quality care to our community, but with non-traditional hours.
Let's see, the express care is right in front of Flower Estates, between the hospital and the interstate on Highway 21, is that right?
That's right. It's very centrally located. It's about 2 blocks south from the main campus.
And when you say non-traditional hours, so if I'm picking up a child from school at 3:30 in the afternoon and my child is running a fever and their primary care office can't see them that day, could we pop in on the express care?
Absolutely. That happens a lot. We're open Monday through Friday from 2 to 10:30. So we welcome walk-ins, no appointment necessary. So if you find yourself in that situation, you are certainly welcome to bring your child by.
Okay, so from about mid-afternoon 2:30 till about 10:30 at night, and the idea there is primary care offices in most cases are into their afternoon and then closing, and then in those evening hours there's really nothing but the emergency department or an urgent care. So let's talk a little bit about how express care can be different from urgent care.
Sure. So express care it offers services you'd expect from your primary care provider, but like we talked about, it fills that gap of evening and weekend hours. So we offer services you'd expect from your doctor. We have the added capability of doing x-ray on site.
So you do have kind of like an urgent care.
Yes.
So I think for most people, you know, there's a hesitation, do I need the emergency department? This doesn't quite feel like an emergency, and that's usually the red flag to say to yourself, maybe I should choose urgent care. And in your case, you can do urgent care at the express care, but express care is considered a primary care clinic, so depending on my health insurance, it may be much less expensive for me to come see you than an urgent care.
Exactly, that's an excellent point. It may be a little lower cost to come see us and get you taken care of.
Okay, so you know, my first thought was if I'm picking up my child and I'm worried about a fever or something that kind of looks like it may need checking out, but let's say after dinner it's 9:30 at night and suddenly experiencing some abdominal pains and just not really understanding what's going on, but once again not feeling like what I'm having is an emergency. That might be a reason to come see you at 9:30 at night.
Yes, yes, absolutely.
Okay, and so you mentioned the 2:30 to 10:30 Monday through Friday, but what about the weekend?
So on the weekends, we have hours between 9 and 5:30.
Okay, so 9 to 5:30 on Saturday or Sunday. So if I'm out in my yard, see, I'm putting myself in all of these little conversations. I'm trying to imagine going to use the urgent care. Okay, if I'm honest, it's not me in the yard, it's my husband. Let's say he's cutting the grass and there is a minor accident and there's a little blood, but it's beyond our capabilities with Band-Aids, but it doesn't feel like an emergency. Is that you?
Absolutely.
Okay.
Yes.
So right there between the hospital and the interstate, conveniently located, we're going to pop in there, and what's going to happen from the time I get into the parking lot? Is it far?
Oh no, the parking lot's right in front of the building. When you walk in, you will check in at the front desk, and then we'll get you roomed, and then we'll definitely assess you and get you taken care of.
Okay, so if something happened, I might come see you and be finished with you in an hour or less.
Oh, for sure, for sure.
Oh my goodness.
We try to get you back going quickly, get you on your way.
And what makes your express care equivalent to an urgent care really has to do with that ability to do some diagnostics on site. You mentioned x-ray.
Right. We do have x-ray capability, so if we suspect that we may need to do an x-ray, we can certainly do that. We offer some point of care testing as well, so we can check for strep, flu, mono. We can check blood sugars, urinalysis. We also have a rapid COVID test that can be done on site in about 15 minutes. We've been doing a lot of that in the last few months. We also offer some select immunizations, such as the shingles vaccine, flu shots, tetanus shots, for example.
And speaking of COVID and Express Care and vaccines, the Express Care Clinic, when it is not open for Express Care, is doubling as St. Tammany Health System's primary location for the COVID vaccine.
Absolutely, you're correct. So in the earlier hours when Express Care is not open, it is functioning as a place to get the vaccine.
Fantastic.
It's been very busy, yes.
And I know that for everyone in St. Tammany Parish and everyone everywhere, what we need is herd mentality, and what we need to get herd mentality is for everyone who can to get out there and get their vaccine.
Absolutely.
So we want to see people make their appointment. I think it's 985-898-4001.
Yes.
And they have that appointment, and they come to Express Care, and they get their shot, and then they have a little bit of observation for about 15 minutes, and then they're free to go. And they have the added benefit, having had their vaccine there, to now know where Express Care is located.
Exactly.
So when that incident or accident occurs that isn't worth going to the emergency department for, they can pop in on you at Express Care.
Yes.
Okay. Now tell us again the types of care that you might come to Express Care for.
Okay, so it's going to be acute illnesses that are not life-threatening. So cold symptoms, runny nose, cough, sore throat, flu symptoms, fever, body aches, sinus infection, earache, I mentioned sore throat, urinary tract infection.
So running the gamut of all the things that if I have an established primary care physician, I might be seeing them for those things, but I might choose to come see you if I need those things off hours. And if I'm someone who hasn't established with primary care and who maybe works odd hours or for whom daytime hours are just not convenient, Express Care is a really good way to address that primary care or urgent care at Express Care.
Absolutely.
Fantastic.
Absolutely.
Well, Kira, thank you so much for coming in and educating us on Express and urgent care.
Of course. Thank you for having me.
Next up on Healthy Living, we're going to look at another level of care. We started off thinking about primary and family practice with Dr. Catherine Pichon. Next spoke with Kira Smith, who taught us about Express Care and urgent care. And last, we'll be visiting with Rebecca, who is the manager of the Mandeville Emergency Department, and she will talk with us about emergency services from trauma all the way to unexpected incidents and accidents. Coming up next.